come in.
Hi, Ms. Kessler. How are you today?
Good, how are you?
I'm good. My name is Robbie. I'm a nursing student from OSUIT, and I'm going to do a head-to-toe assessment on you. Is that okay?
Yes.
First, let me check to make sure that I have the right patient. Can you tell me your name and your date of birth?
Brittany Kessler, 7/12/87.
Thank you. That's correct. I'm going to wash my hands, and then I'll get started, okay? Okay, I'm going to do, like I said, the head-to-toe assessment is going to go from your head to your toe. I'm going to start at your head and work my way down, okay? When I get to your head, I'm looking for any lesions, any bumps, any abnormalities, or any infestation, and I see none of that while I'm looking. And next, I'm going to look in your ears and feel your ears. Your ears are also known as auricles. Will you tell me if you have any pain while I'm doing this? Is it okay?
Yes.
Okay. And I'm going to look inside your ears. I'm going to check for any serum blockage or any drainage. Don't see any in that one. And I don't see any in that one. Your ears look good. And now I'm going to palpate your sinuses. First your frontal that is at the top and your maxillary that's down below. And will you let me know if you have any pressure or pain when I'm doing this? Everything feel okay? Okay. And next what I'm going to do is I'm going to look at your eyes. I'm going to check your conjunctiva. Will you look up for me? And it's pink and moist. And the next, will you look down? I'm going to check your sclera. Your sclera is white. It's both normal, like it should be. And the next thing I'm going to do is I'm going to check your eyes. Check your pupils first. Just look straight ahead of me. Okay, that's good. And now I'm going to check your accommodation. Will you look from the pen to the wall and back to the pen? Great. And now I just want you to keep your head still. Follow with your eyes my pen. Okay? Okay, and that looks good. Your eyes are pearlin. That means that your pupils are equal, reactive, round to light and accommodation, which that's normal the way it should be. Okay? And the next thing I'm going to do is I'm going to look in your nose. So if you'll look up for me. Okay, and your mucous membranes are moist and pink like they should be. You can look back at me. And I need you to flare your nose out for me. Great, thank you. And I'm going to make sure that you have patency on both sides of your nose by just pressing my finger up there. Is that okay? Yeah. Okay. Okay. And okay, and I'm going to check one more thing. I need to check your septum, so if you look back up for me. Okay, and you have no deviation of the septum. It's aligned like it should be. So everything so far is looking good, okay? Okay. Now I want you to open your mouth for me, and I'm going to check your mouth. I'm going to look at your hard palate and your soft palate, your uvula. I'm going to check your teeth and your tongue. Can you stick your tongue out for me? Okay, you can put it back in your mouth. And go to the left side and the right. Great, thank you. Your teeth are aligned like they should be. Everything, your hard palate and your soft palate are intact. Your mucous membranes are moist and pink. I'm going to check your gums just really quick. Okay, and they're pink and moist also like they should be, and your lips are pink and moist. Okay, and now I'm just going to move on down because I'm finished with the face. I'm going to check your trachea, and I'm going to check your thyroid, okay? I'm just going to palpate right here. And your thyroid, your trachea is symmetrically aligned, I felt no abnormalities on the thyroid. The next thing I'm going to do is I'm going to listen to your carotid, okay? I just need to put on my stethoscope for that. I'm going to listen to make sure that there's no bruits. Okay, and I hear no bruits. If I did, you would need to go see a doctor, okay? Next thing I'm going to do is I'm going to check your temperature and your sugar. I'm going to do that with the back of my hand. Can I touch your skin on the front? Okay. Okay, and your temperature is not abnormal. And your skin sugar is elastic. And the next thing I'm going to do is I'm going to listen to your lungs. Is that okay? Okay. Can you take a deep breath for me? That's great, thank you. And while I was looking at your skin a while ago, I didn't see any abrasions or bruising, and that's good. And I'm going to go on around to your back, and I'm going to check your lungs in the back, okay? Okay. And while I'm back here, I'm going to go ahead and check the alignment of your spine. I'm going to feel it all the way down. And your spine appears to be aligned. I don't see any lordosis, kyphosis, or scoliosis as I'm feeling. And the next thing I'm going to do, I'm just going to listen to your lungs in the back. Can you take a deep breath for me? Great. Thank you, and another. 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 One more. One more. And I'm going to make sure that I check for the lower lobe on the right side. One deep breath there. Thank you. I'm just going to feel, I want you to take a deep breath in and out. That's great. Your lungs are equal bilaterally. They move like they should, and that's great. Okay, the next thing I'm going to do, I'm going to check your pulses on your arms. I'm going to check your radial pulses and your brachial pulses. Your brachial pulses are here. And they were equal bilaterally. I'm going to check your radial pulses. And they are equal bilaterally. And have you done a self-breast exam before?
No.
No. Okay, I'm going to show you how to do one. And the best time to do one is, first off, you need to do it once a month. The best time to do one is 2 days after your menstrual cycle. And if you can remember to do it that way, then you can do it the same time every month, which is optimum. Okay? And usually if you're in the shower, it's easier to do it in your shower because your body's already wet and your hands can move around well. Okay? Okay, and I'm going to show you how to do it, so if you'll just watch the way I do it and just mimic me. Okay? If you'll take your hand and put it back behind, that's great. Take your other hand and put it under your axillary because sometimes we can have bumps and stuff there, so we need to make sure that we don't have any. Okay?
Okay.
Okay? And then what you're going to do is just palpate in a circular all the way around. All the way around. Make sure that you're touching everything.
Okay.
Let's go around one more time.
Okay.
Okay? And then I want you to just gently squeeze your nipple to make sure that you have no discharge.
Okay.
Okay? Okay, and we're done with that. If you had felt anything, you would want to contact your physician and make an appointment to see if there might be something there. Okay? Okay, and now I'm going to listen to your heart. Okay? I'm going to palpate to make sure that I feel nothing unusual, such as pulsations, and I don't feel any pulsations. Okay, everything feels okay. I'm going to listen. The first place I'm going to listen is to your aorta, which is to the right of the sternum in the second intercostal space. And then I'm going to listen to your pulmonic valve, which is to the left of the sternum in the second intercostal space. And then to your Erb's point, which is in the third intercostal space. Your tricuspid, which is in the fourth intercostal space. And your mitral valve, which is in the fifth intercostal space. And now I'm going to listen to your apical pulse, which is in between the fourth and the fifth intercostal space, which is midline to the clavicle. Okay, and I hear no murmurs or dysrhythmia, and that's a good sign. Okay, and now I'm going to, I want you to give me your hands, and we're going to check your strength. Will you squeeze my hands for me, please? Great. And how about push down on my hands? And push up. Good. And then I'm just going to check your range of motion. If you could do your flexion for me, your extension, your adduction, and your abduction. Great. That's great. Now I'm going to go ahead and have you lay down, and I'm going to check your abdomen. Okay. And I'm going to listen first to your quadrants, and then I will palpate, okay? And just looking right now, your abdomen is midline. I see no distension or bulges or anything abnormal. And I'm going to start on your right lower quadrant and listen. And I'm going to move to your right upper quadrant, and your left upper quadrant, and your left lower quadrant. And your bowel sounds are normal. If there's two other kinds, there's hypoactive and hyperactive. Also, I want to listen to each one for 1 minute. If I don't hear anything within that 1 minute, then I would need to listen for 5 minutes just to make sure that you do have bowel sounds, okay? And then now I'm going to palpate to see if I feel any enlargements or anything abnormal. And I don't feel anything. Everything feels okay to me, okay? And now I'm going to move on down to your feet. I'm going to check your capillary refill in your feet. And your capillary refill is less than 3 seconds, and that's great. And will you push on your, there you go. And I'm going to do your range of motion. This is flexion, and this is extension. This is abduction, and this is adduction. And I'm going to check your pulses here. I'm going to check your dorsalis pedis, and they're equal bilaterally. And your posterior tibia, and it's both equal too. Okay, if you'll sit back up for me. Okay, I've inspected you. Your skin is free from petechia. It's free from edema. I didn't see any lesions, and everything looks okay. If you have any problems, you need to check up with your doctor, okay?
Okay.
Thank you. It was very nice meeting you.
Thank
Have
you.
a great
Nice
day.
to meet you. You too.